there. So my name is Sarah, as Elena said, and I'm still an MPH student. This is my third summit, and this is my capstone project, which is in progress. And so I'm really excited to have the opportunity to be speaking on this panel and get some feedback both from the discussants and the audience as a whole. This is the project that I'm working on with Lorraine Holinka-Malko, who is my current supervisor and a co-author on this presentation. Although I'm tempted to spend my entire allotted time thanking all of the people who have helped shape my thinking in gay men's health in this city and beyond in the past few years, I'm just going to briefly mention some organizations and participants in research projects that I've been involved in. So that includes, but isn't limited to, the Health Initiative for Men, the CIHR team in the study of acute HIV infection in gay men, the Community-Based Research Center, and the Gay Pod Sex Project at Positive Living BC. And the last thing I'll say before I start the substance of my presentation is that I'm very committed to being an ally to the most inclusive notion of a gay men's health movement. That said, sometimes I get it wrong. And so it's very important to me to get the feedback from the people in the communities that I'm speaking about and hopefully working for. So with that, so I just wanted to first acknowledge the space in which I live and study is unceded First Nations land, and that these diverse people continue to fight for social justice, sovereignty, and equity. And this is both a significant issue for our national, provincial, and municipal governments, as well as for people who work in gay men's health. So arguments have been advanced at this summit have definitely emphasized the difference between gay men and MSM. And so for me, when I say gay men, I'm including cisgender and transgender men who are primarily attracted to men and identify as gay, queer, two-spirit, homosexual, or other ways that recognize that sexuality. Unfortunately, my presentation is limited to the experience of those men, and I'm not considering the experiences of bisexual or heterosexual men who have sex with men, although I recognize that that's important work, and I hope that somebody else will take that on. So my presentation is a little bit about going beyond this buzzword of resilience, which is something that has been talked about quite a lot in the past few years in gay men's health. So that's what I'll be talking about today. So although there has been much discussion of the concept of resilience in gay men's health literature, particularly over the past decade or so, there hasn't been a systematic review of looking at how that word has been defined or operationalized or measured in the literature. And so it kind of emerged out of the activism of gay men who were frustrated, understandably so, with all of the medical, legal, and criminal pathologization that was going on. And so that was kind of the starting point for this being taken up in the academic literature. And some of the other work that I'm working on is actually looking at what happens when activist work ends up being taken up in the academic literature. But I won't be sharing that with you today, but I'm happy to talk about that later if people are interested. So my work began with a review of where the concept of resilience came from in the first place. And I was really interested to learn that it first emerged amongst looking at the maltreatment of children. And the people who first used it were very concerned about emphasizing the fact that the first duty is to prevent maltreatment from happening to children. And then secondly, to helping children who had experienced maltreatment adapt throughout their life course. And so since about the 1980s, there's been a continued shift towards a study of resilience in the other disciplines as well. So this quote is from one of the most prolific gay scholars who kind of first started this call for resilience. And it's from 1999 when he hosted a summit in the US where the call for resilience was kind of the fifth key point that he wanted to address. And so I'm just going to read this quote briefly for you. And finally, fifth, we want to transform the ways in which we think about and evaluate gay men, shifting away from a perspective which exoticizes, demonizes, and pathologizes our bodies and our lives into a model which recognizes the tenacity, survival skills, and overall resilience of our cultures and communities. What would it mean to understand openly gay men as the resilient portion of our community, that portion which has suffered physical assault, religious abuse, and political violence, yet emerged emotionally intact and spiritually strong? What would it mean to understand our gender play, kinship networks, and sexual cultures not as pathetic products born of a homophobic society, but as adaptive survival strategies which have served us well? So citing this work, a lot of Canadian gay men's health documents produced in the early 2000s started to acknowledge the importance of recognizing resilience in the policy and programming and research that was going on. And so there was two key points made in this 2001 document about what resilience means for gay men. And so they emphasized the fact that resilience is both located in gay men as individuals as well as the diverse communities of gay men, and that resilience is informed by gay men's experiences of heterosexism as well as their kind of personal resistance to other interconnected forms of oppression. This shift towards resilience has also been seen in the wider literature of sexual minorities, particularly among adolescents. And Rich Savin-Williams is one person who has really argued that media sensationalism has kind of overrepresented the stories of GLBTQ youth who have been marginalized or excluded from their homes, and in doing so has only focused on a very limited picture of what the lives of these people are like. So while there's no consensus definition of resilience kind of within or outside of gay men's health, a 2011 review looked at a bunch of definitions that have been published in the last 30 years. And this is kind of the definition that they came up with. So while there hasn't been kind of a consensus around it, it's one that's informed by a lot of the work that's happened. So individuals' mental health in the face of adversity, and why some individuals are able to experience adversity without negative ongoing physical and mental health outcomes, and others aren't. So with that in mind, what I've done as part of my capstone project is conducted systematic searches in 4 databases, so a nursing database, Medline, PsycInfo, and social work abstracts, with the 3 kind of concepts that I've outlined on my slide. So looking at the concept of gay, the concept of man, and the concept of resilience. I didn't place any date limits on my searches and found a total of 245 articles after eliminating the duplicates. And then using my inclusion and exclusion criteria, which required that articles talked about resilience in the context of gay men as humans, so not looking at sort of genetic resilience and gonorrhea that some gay men might have, but looking at the resilience that gay men as individual, holistic human beings would have. And so I've identified 131 articles that specifically use the concept of resilience in relation to gay men as humans. And this presentation is going to focus on 21 of those articles that provided explicit definitions of resilience. And that might be something that, as I kind of expand this paper, I talk more about the fact that only 16% of all the articles that have talked about resilience in gay men provide a definition, might raise some concerns. So most of the literature of those 21 articles, most of that came from quantitative literature or review literature. So kind of looking at generally what the literature has said around resilience, or quantitative studies that have operationalized resilience in specific ways. Most of the study populations were people living with HIV, so including literature published early in the epidemic where long-term survivorship was defined as living for 3 or more years, and then also more recently youth. And studies reported demographic breakdowns of their samples, but rarely kind of included analysis of how or why these demographics mattered for the things that they were seeing in their data. Most of these articles also used a non-specific concept of resilience, so they just talked about resilience generally, but there was a few subtypes that were specifically mentioned. So couple, ego, family, educational, emotional, and psychological resilience were some of the more specific ways that this concept got used. And so what I'm going to spend the rest of my time talking about today is kind of 3 characteristics that were common across these 21 definitions of resilience. So resilience is usually talked about as being an outcome of a dynamic process. Resilience is usually about individuals adapting or responding to adversity. And resilience is usually defined when some sort of researcher-defined positive outcome has been achieved. So the first characteristic that I mentioned is resilience as a dynamic process. And so this slide presents my image or a visual representation of that. And so in the literature, we see that resilience is a process in which an individual is negotiating with some combination of the social environment and resources. And so sometimes it's the individual is negotiating with his social environment in order to get resources, in order to cope with adversity. Sometimes the definitions are more focused on an individual's internal resources or characteristics, and so those are often things like personal hardiness or courage to challenge in different quantitative scales, looking at specific psychological indicators, and different versions thereof. And so this is all happening within the context of adversity in these cases. So in terms of the second characteristic, which is adapting or responding to adversity, we see that adaptation or response is often defined as behavioral, social, or psychological adaptation. So there's a diversity of adaptations or responses that people think happens as a result of resiliency. Resiliency can also emerge in the context of either an acute adverse event or a chronic adversity. So examples of acute adverse event might include suicidality or suicide attempts in some cases, HIV diagnosis, loss of a partner, and whereas chronic adversity is usually talked about as systems of oppression or the ongoing potential for HIV infection. And again, these are things that the literature has said. Most of the literature focuses on heterosexism as the primary system of oppression, and some of the literature, but most of it does not look at other sorts of interlocking systems of oppression. And then the last characteristic is this idea of positive outcomes. And positive is in quotes because part of my presentation is looking at who gets to define positive. So there's kind of 4 different types of outcomes that are looked at. So thriving despite adversity. So that's people who are negotiating adversity and are kind of doing very well in the context of that, better than expected according to kind of statistical tests around what you would expect to happen as a result of something like heterosexism or more acute events. Getting through, so that's just being able to function normally and not better than expected in the case of adversity. Bouncing back, so that's definitely in the context of an acute thing. So if you receive an HIV diagnosis and then in 6 months are kind of returned to your normal level of functioning, as the literature talks about it. And then lastly, growing from exposure to adversity. So that's the idea that what doesn't kill you makes you stronger, and that you end up much better off having gone through a period of adversity, whether that's acute or chronic. So I also just wanted to talk briefly about some of the factors that the literature suggests that build resilience in gay men. So what are some of the things that allow for this process to happen and result in these positive outcomes? So successfully negotiating coming out is one of the most commonly discussed aspects in the literature that I've reviewed so far. And so that happens both in the literature that discusses people who are much older, so looking at seniors or people who are over the age of 60, depending on how the literature looks at it, and saying that because those people had an experience of coming out in their younger, either childhood or adulthood, and that has prepared them for this kind of later in life transitions. So individual constitutional factors, so that's again like self-esteem or kind of personal ability to adapt to different challenges. Social support across the life course, so particularly in the definitions of educational resilience, social support across the life course was measured as having one consistent adult that a student could go to in seeking social support. And then at other periods in the life course, it could look like having a very supportive friend network or a chosen family or things like that. And then lastly, something that emerged not very often, but I was really excited to see happen in the literature, was this idea of multiple experiences of oppression. So looking at the fact that people's experiences of discrimination or oppression in one area of their life might help them negotiate those same or similar types of experiences of oppression based on a different characteristic. So with that kind of presenting those findings, I just wanted to go briefly into some discussion about this. So some of the concerns that have been raised from the community, and these are gleaned from a report done by Katie looking at new directions in gay men's health, which was the result of a pan-deliberative dialogue and was written by my co-panelist, Len, as well as some of the work that's happened at the Ontario Gay Men's Summit and other places as well. So some of these concerns have come from gay men in those contexts who have talked about the fact that while resiliency is a strength in some contexts, it may heighten vulnerability in others. So the idea that, you know, I can get through it by myself and I can cope with all of this challenge might get you out of a really damaging situation in one case, but make it very difficult for you to ask for help in another case. There's also an unparalleled expectation of resilience amongst gay men. So we expect gay men to just deal with a lot of heterosexism and adversity in other forms and be okay with it, whereas we don't have that expectation for a lot of other people in society. Thirdly, there's a concern that resilience depoliticizes gay men's needs and makes it again about building resilience in an individual. So allowing an individual to cope with these bigger political problems and not see them as political problems. And this kind of is very reminiscent of work done by Jeffrey Rinaldo. And then lastly, the concern is that it's a very narrow definition in a lot of the literature, but not all of the literature. So some of the literature defines resilience as being HIV negative in a long-term relationship and owning your home, which is maybe problematic if that's not the goal that you set out for yourself. And so in the discussion that the criticisms that I've raised about the concept of resilience, I've used the framework of intersectionality to kind of inform my understandings of what's happening. So the reason that we chose intersectionality, which is something that's been developed by women of color in relation to the feminist movement and has a long legacy both in policy, health, and legal areas. Intersectionality emphasizes the multiplicity and simultaneity of individual identities, diversity within the ways that these identities are experienced, and starts to focus on the processes through which difference is ascribed on the basis of social locations that create and construct difference and inequities. So that's kind of a lot of terminology, but it's the idea that what people's perception of who you are or what your social location is informed by a lot of systemic issues that may or may not impact kind of how they treat an individual. So with this in mind, I focus on some of the limitations of the definitions, and this again is just my preliminary analysis, but some of the limitations include that measures of resilience are often Eurocentric and based on mainstream values, however we define that, and so don't kind of account for this diversity within the lives of gay men and within the lives of the general population as a whole. The systems of oppression that people are resilient to are often left unexamined. So if you remember that image that I had about this dynamic process of resiliency, that whole background was adversity. And so that adversity is often defined as a system of oppression, and we never really look at what that system of oppression or what is perpetuating that or how we can change that system, and are instead looking at how we can build resilience in an individual. And then rarely, if ever, and in the definitions I looked at, there was no community level assessment of what resilience was. So we were always measuring resilience within an individual and maybe considering his or her social support, but not looking at kind of what it means to be part of a community that has survived and been very strong leaders in health and other areas as well. So in terms of moving beyond the existing definitions, I think it's important to kind of take some of these considerations into account. So we need to recognize that risk and resilience are not dichotomous ends of a spectrum. So we have risky gay men and we have resilient gay men, and they never interact or kind of move along that spectrum. And a lot of the literature, or some of the more progressive literature, I guess I should say, argues that risk and resilience actually happen simultaneously. So what I said before about how resilience can be a strength in some contexts and create vulnerability in others. Also, like returning to kind of the roots of the term of resilience, we need to think about preventing the adverse conditions that create resilience. So again, what are we doing about heterosexism and various interlocking systems of oppression as well? Creating space for diversity within healthy gay communities. So and this is kind of an exciting question, and also a very challenging one, where we need to kind of imagine what healthy gay men and healthy gay communities look like in order to be able to measure if we're getting there. And so in summary, there's a variety of definitions, measures, and operationalizations of resilience, and that there's concerns advanced both in academic and non-academic forums regarding the social and health equity implications of resilience. So some next steps for my work is I'm going to work on incorporating the literature on resilience that have emerged among Indigenous people and other groups experiencing minority stress into both my discussion and my introduction, expanding the analysis that I've done on those 21 definitions to the rest of the 160 so articles I have waiting for me to read, and discussing the relationships between protective factors, so whether or not you have social support, whether or not you have a supportive adult in your life, those types of things, and the process of resilience. So, and I just wanted to acknowledge the University Without Walls and Simon Fraser University for my mentorship and guidance in working on HIV-related stuff in Cayman South. So thank you.